I want to say it was about a little less than a month, a few weeks ago, right, Marty?
Well, yes.
Yes.
And so I understand there's been some developments now. As you guys may recall, we had a very emotional interview with Marty and her husband Benny, as Benny was hospitalized due to the coronavirus. They had Take Care insurance at the time. Take Care had said they weren't covering any COVID-19, but you kind of remind me of Aaron Brockovich a little bit. I don't know if you've seen that movie,
Yes.
but
My
you,
mom laughed at that too. She was laughing when I told her what you called me.
yeah. So you kind of went into the fine print and went toe to toe with the big bad insurance company, and now it looks like they are going to pay for your bill. Is that what's happening here, Marty?
Yeah, we finally got an email on December 1st because we were last on your show just before Thanksgiving. And there was that, the day after we saw a letter to the GCA from Take Care that said that they were covered COVID treatment and hospitalization was also in there. So I wrote back to Take Care and I said, wait a minute, now you're saying you cover it because, we know it's open enrollment. So I think the combination of the media, public awareness, the open enrollment timing, and then of course the speaker's strong letter to the U.S. Attorney, the AG, and Daphne Shimizu as the insurance commissioner, all of those efforts really put the pressure on them so that we could get an answer right away. So as of December 1st, I was notified that they did pay. The way that the attachment was, they broke it down by provider. And so the GMH as provider was $16,027.27. And then there was the providers that totaled $3,756. So we were informed that we only had to pay our two $100 copays, which is what I read in my benefits, the $100 for the October 12th ER visit, and then the $100 for the hospitalization, because the ER rolls into the hospitalization and is waived, so there's only the one copay. But it did take a lot of effort, and you guys were with me. It was the roller coaster. It was, you get the denied COVID treatment letter back on October 19. Then they had another letter that came through, but it didn't really make sense because it said denied admission until they reviewed the bill. And I'm like, what does that mean? Prescribes that you need to go to the hospital from ER and you're going to deny it. I mean, it just, it's just the whole mental distress that we went through. And then finally seeing the GCA, email blast that, oh, we're covering it. And it's like, wait a minute, you haven't covered it because you haven't changed your decision on our benefit. So I kept fighting it more. And so we finally got an answer where, yes, they are going to cover it. They are paying GMH, which is well deserving because those frontline heroes saved Benny's life. We should all have that community spirit and compassion. And, this wasn't just a fight about us, it was fighting for GMH too, because we didn't want to see them wait 6 months for an appeal process.
Is this a policy change with Take Care, Marty, or do you feel like it was because you went and made a lot of noise about it?
I think it's because of our public awareness campaign, because we brought out to the attention that, they were trying to start on the exclusion and the exclusion did not stick. As Speaker said, they had legal opinion look at it and they did not meet the requirements of that statement because it said that it had to result in their facilities, their personnel, and their financial resources being unavailable, and they are available. So it would, void that statement. So when we put the pressure on them, then that's where it really, I think it really helped to get immediate attention to it. I feel bad if there's other people that really have to wait out the whole 6-month process. I'm not in politics, but I would suggest that somebody look at that 6-month appeal and make it shorter, like 60 days. I don't know how they can possibly do that, but we've read the media announcements back in March, that they weren't allowing Take Care due to unpaid bills. Then September, they allowed them back. And then a month later, Benny got sick and was hospitalized. So fortunately for the timing that when Benny had to go in, they were accepting it. So, it's scary because we pay our premiums and you want to be able to know that the hospital is going to accept you, and you don't want to be caught in the middle of these, unpaid bill disputes.
Are you aware of GMH's? Are you aware of GMH's received the payment? I'm not sure where that's coming from.
I only have the email of the check number and the amount. I was actually asking Peter Santos to see and verify, with maybe Lillian or whoever at GMH. But
Right, I just got a message from Peter. He said the CFO, GMH is still waiting for payment. The CFO says she's unaware of any payment by Take Care. that was just
okay.
from him. Yeah.
Yeah, so that's just it. It's it's like I only have an email that says this is what the check is made out to. So and one of them being 13,000, the 16,027 is for GMH, and then the 3,756 to the 8 various providers. And I guess that makes sense because I know GMH is using FEMA resources, military resources, so they kind of broke it down by provider. Some different rates applied. So, but yeah, I couldn't really decipher the bill because I'm not a medical billing person, but it makes sense that it was broken down per provider.
Right. And we know Take Care is not, GRMC doesn't accept Take Care, so there's not really many options out there for their subscribers. But, so they sent you the check number, but we haven't got the confirmation from GMH. At what point would seeing be believing for you, Marty?
I honestly don't know. It's just, we just finished open enrollment. And of course, like I said, Take Care is the only option. So, for us, we trust in the Lord and move forward and hope that, we keep an eye on everything. I did notice that in my GS for 2021, that exclusion is on all plans now. So but again, the exclusion should not have applied because their facilities are available, their personnel is available, and of course they got the financial resources because we're all paying our premiums. So, but at least I know that my financial responsibility is just the $200 copays, which is for the plan that I did choose. But that's why there was a part of me that I just said, Peter, I don't know if we can confirm if they got payment or not. I only know that on my December 1st email, this is how the bill is being broken down and that how they're going to issue the 2 checks.
So what's next for you?
Well, we keep moving on, but I do question to the legislature that I don't know if it's possible for them to look at the appeals process and to look at the statute of limitations to lower it from 6 months down to 30 or 60, because I mean, this was about a 60-day process for us to get it, fixed. So, but it's just the fact that the bill's going to GMH. If they're taking a 6-month appeal process, to me, that's not fair. I mean, I'm just looking out for the front line, because my 2 youngest kids are medical frontliners in San Diego. And, I hear the stress that they go through and everything, from what I understand, California is about to be locked down again because the numbers are rising.
Yeah.
It's scary. My youngest Tally, she works in a children's hospital, and then my Kaiser's Kaiser Permanente chain. So, it's very scary out there. And, the one least thing that you need to worry about is that, are people going to pay their bill so that we don't have that added stress?
Right on. Totally agree.
But I thank you guys so much for helping spread the word. I thank Speaker so much for her assistance. I really know that the media coverage that you guys provided us with and being able to spread the word out there. There was a funny story of Benny going through the Naval Gate recently when he was going to work, and the military police checking his ID recognized his name from your show. And he swiped it and he looked at him and he goes, "So did Take Care ever pay their bill?" And Benny was just just like he didn't know where this was going. He goes, yeah, they told us that they're paying it now. And he goes, good for you, you know?
Come on in. Good for you.
You know, so, but fortunately, we haven't had any new cases on the naval job site, so that's a good thing. That means NAVFAC's extra security measures have been working, and you know, we just keep praying. Of course, today, Viva Santa Maria Camelin. Keep protecting our
Viva!
island. Right? And Sabrina, I'm so glad you tested negative.
Oh, thank you. I am too.
I had to close my eyes. I cannot watch needles go in. I can't watch that swab go up. Yes,
Oh.
I had to close my eyes.
It was terrible. You know, I knew deep down it was just my allergies, but you know, I had to make
Better
sure.
safe than sorry.
Yeah.
Jason was kind of worried.
Yeah,
So,
but it does leave like a weird alcohol kind of feeling, like somebody left the alcohol or a piece of
Mhm.
Vicks up there.
For real. It was like that the whole day. Like afterwards, it was, oh, you just can't help but like squeeze your nose because you feel like there's something
Yeah.
still there.
I think Sabrina's like a lot of us, and you know, our nostrils, they're supposed to be an outie, not an innie. Exit only nostrils.
Yeah, I've been through it, what, 1, 2, 3, 3 times. It's
Wow.
like, oh, it's not a good feeling.
Right. Yeah.
The Binax now, though, those rapid antigen tests, piece of cake. But you're right.
Really?
Yeah.
Oh.
They don't hurt at all. So whenever they have the community testing again, it doesn't hurt. It's fine. But I was just
So the only
panicking. I was
So the only
panicking.
question is it covered?
Yeah, it's free. Oh, well, I don't know about I hope so.
Hi, a day. Take care. Hi, a day. Marty, thank you for catching us up on your situation, and keep us posted, okay?
Okay, Merry Christmas, everybody.
Christmas.
You too. We're absolutely loving the matching mask and
Yes.
blouse.
Oh, yeah.
Yes, right? Style.
Hey.
Viva tomorrow.
There you go. Viva, viva. Okay, Parr. Thank you, Marty.
All right, see you guys.
That's
Bye.
that. Okay.
Stay
Bye.
safe.